Good afternoon, everyone. My name is Tarnika Manning, and I'm the Community Outreach Manager for Metropolitan Chicago Breast Cancer Task Force. We are a non-for-profit organization fighting to end disparities for breast cancer mortality rates among women of color. For more information, please check out our website, which is www.chicagobreastcancer.org. You are watching a live call-in television program brought to you on CanTV 21, and we also are online at cantv.org/live. During our show, we discuss various breast cancer issues that affect women of color in Chicago. I invite you to call in if you have any questions. Our phone number is 312-738-1060. Our phone lines are open. So today we're going to talk about CountyCare. Today our guest is Sydney Thomas. Mr. Thomas has been employed with Cook County Health and Hospital Systems for over 20 years. Currently, Sydney is the Director of Provider Relations at Cook County. He also serves as the implementation team for CountyCare, which we're going to talk about today. So if anytime you have any questions for Sydney, please give us a call at 312-738-1060. All right, so welcome.
Well, welcome.
Thank you for joining us today.
Thank you for having me. I'm glad to be here.
All right, so tell us a little bit about yourself and your role at Cook County.
Well, as you said, I've been with Cook County Health Hospital System for about 20 years. My current role is Director of Provider Relations, and in that role, I helped develop the CountyCare network. And we'll be talking about CountyCare during this segment. But my primary role is to build the network, is to make sure we have enough providers to take care of the CountyCare members.
Okay. So I guess the main question is, what is CountyCare?
What is CountyCare? Okay. CountyCare is an Illinois Medicaid program.
Okay.
It is an early implementation of so-called Obamacare. The Affordable Care Act, or Obamacare, has two components. One is expansion of Medicaid to eligible adults, and then of course, the marketplace where you can buy insurance. And I wanted to emphasize eligible adults. This is an opportunity for adults who traditionally could not get Medicaid. Medicaid was often directed toward women, pregnant women and children. So this is an opportunity to attract and enroll adults who need health insurance and previously were not eligible.
Okay. I think we have a caller.
Wow, that's fast.
Yeah, really fast. Caller, you're on.
Hi, I'm speaking as a father, maybe even as a son. The county had a program where they had these trucks that went out and give women these mammograms. Had that program had been cut or reduced or whatever, and if it has been cut out altogether, we need to think about that sort of stuff when it comes election time. Can you respond to my question or my comment?
Sure. Yes, the Cook County Health and Hospital System did have mobile mammography vans at one time. We discontinued that service. We found that although it played a role in many areas, it was also fairly inconvenient, and we really thought there were better ways to help women access mammogram services. So you're right. We had the service. It was discontinued, but we wanted to make sure that we were providing the best service, and found that the maintenance of the vans, the upkeep of the vans, making sure it was a comfortable space where women felt comfortable getting their mammograms on a van. We couldn't guarantee that was the best venue for providing mammography services.
Thank you for your question. That was a great question. And we also like to stress that breast cancer is just not a woman's disease. We thank you for being a father and a brother, calling and asking that great question. All right, I think we have another caller. Caller, you're on.
Yes, hello.
Hi.
Hello.
I have a question. My question is, what are the benefits of enrollment before October 1st?
What are the benefits? CountyCare is up and running now. If you apply for CountyCare, you can start your coverage now rather than waiting to January 1st. So if you wait for the marketplace to open and apply through that route, your benefits will not start to January 1st. If you enroll in CountyCare now, your benefits will start within about 6 to 8 weeks of your enrollment, and you can start getting care more immediately.
Okay. I think a follow-up question to that is, because what she was talking about was more of the Affordable Care Act being kicked off and October 1st. And
Right,
we've
right,
been
right.
hearing that date so often. October 1st is going to be the kickoff.
Right,
So can you
right.
talk about the difference between what you are doing with
Sure,
CountyCare
sure,
and
sure.
The Affordable Care Act in general?
Sure. CountyCare is an early implementation of the Affordable Care Act. The state of Illinois and Cook County partnered and submitted an application to the federal government, and we asked for permission to start early. We wanted to get a head start. We wanted to learn some things about the population. We wanted to learn what it would mean to roll out basically health insurance to a population that had never had that insurance. So this would better prepare Cook County, the state of Illinois, and eventually the federal government for what to expect in January.
All right, I think we have one more caller. Caller, you are on. Hello, caller? Okay, I think we lost the caller. But again, we encourage you to call in. If you have any questions, give us a call.
Yes.
Our number here is 312-738-1060. All right, so who is that targeted audience? You said that, exposing people who have never had insurance before. Who's that audience?
That targeted audience is adult men and women without dependent children.
Okay.
Oftentimes, the route to getting some type of insurance, be it Medicaid or private insurance, was to be employed or to have children. This population had neither. Many of them were either unemployed or underemployed and did not have children or may have adult children. And they could not access health care services. So this is an opportunity for that population to get insurance. And also younger people, because our age range is 19 to 64. So we're also looking at that, maybe new grad from college who needs coverage until they get their first job. We're also looking at that, that 25, 26-year-old who may live with mom and dad still and can't afford to pay for health insurance. So we really are trying to target adults between 19 and 64 who need health care coverage.
Okay. I think we have another caller. Caller, you're on.
Hello.
Hi.
I wanted to know, what is a health care exchange?
Well, the Health Care Exchange, that's another part of the Affordable Care Act. That will basically be a website that you can go to and shop for health insurance. Just like you go online to shop for other items, you would go online, there'll be a number of different plans there, and you will be able to pick the plan that best suits you. So the exchange, another way to think of it, is online shopping.
For healthcare.
For healthcare, yes.
Great question. All right, we have another caller. Caller, you're on.
Yes, I was calling. I want to know if I'm accepted into CountyCare. Do I have to get treated at the county, or can I go to any hospital?
That's an excellent question. That's what you do as far as networks, right?
Yes, we've been very, very busy building a network. We have over 130 primary care sites. CountyCare is based on a patient-centered medical home model. All of our members have what we call a medical home, or just to think about it, their own physician network or team working with them. So to answer your question, you don't have to come to the county in terms of the services that we provide. We're very happy to have you in our primary care system or at our two hospitals, Provident Hospital and Stroger Hospital. However, we have built a network with over 30 hospitals and hospital systems throughout Cook County. And just to name some of those systems, the Vanguard system, the Advocate system, which includes South Suburban and Trinity and Lutheran General in the northwest suburbs. We have community hospitals such as Norwegian, Swedish Covenant, St. Bernard, Roseland. We have academic medical centers such as University of Illinois, University of Chicago, Rush. So we have a number of different choices. CountyCare is based on member choice and geographic accessibility. We don't want our members having to travel a long way to get any care that they need.
Okay. Great. So another question is, what documents are needed to sign up for CountyCare?
Well, basically, you have to have some proof. If you have income, some proof of income. The income guidelines is 133% of the poverty level, about $15,000 a year for an adult, about $20,000 for a couple. If you are employed, we do need to have a month's worth of check stubs. If you're not employed, you sign an attestation that you are not employed, and that's it. You need something to prove that you live in Cook County. Because this is a demonstration project and we committed to enroll Cook County residents, we must have some proof of living within Cook County.
Okay.
You must have a Social Security card or have proof that you have applied for one. You must be a U.S. citizen or have been in the country legally for 5 years.
Okay.
So all those documents must accompany your application for CountyCare.
Okay, I think we have another caller. Caller, you're on.
What type of safeguard, you may already answer my question, what type of safeguards will be put in place making sure the Affordable Health Care Act won't go bankrupt? We look at the state of California, people that providing for state services, they're going bankrupt.
Well, that's a good question. The key to making sure this is financially sustainable is having as many people as possible in the plan, and a good mixture of people. Certainly you're going to have people who have very serious illnesses, but you also need to have your younger, healthier people that need more preventive services. Our experience so far has been that many of the people that we have in the program now have health care needs that have gone neglected for many years. You know, they have not had access, they have used emergency rooms, they have been kind of bouncing around from place to place, and knowing they had no coverage. So they only sought care when it was an absolute emergency room. Oftentimes, if they had gotten care for their diabetes, their hypertension, their asthma, their heart disease on a more regular basis, that emergency room visit would not have been necessary, or a hospital admission may not have been necessary. So the way to make this financially sustainable is to get everybody in, covered, and attached to a primary care provider that they see on a regular basis that can make sure whatever health problems they have are managed.
Okay, I think the main point is preventative care. You want to make sure that you're going in, getting those basic routine check-ins. And what we stress is your regular mammogram.
Absolutely.
So,
your screening colonoscopies,
exactly.
You know, for men, your prostate cancer checks, all those things that need to be checked, you know, per the guidelines in terms of age or whatever. But it's just important that the screenings are done so that if there is a problem, it can be addressed early.
Okay. All right. I think we have another caller. Caller, you're on.
Yes, thank you for taking my call. And I know you all were originally supposed to be talking about breast cancer task force, I think, but I really appreciate this information that you all are passing on.
Oh, thank you for calling.
Okay, my question is, for those people who are on disability, they don't qualify for Medicare for 2 years after being on disability. Are they required, or should they apply for Affordable Health Care Act? And also, if people are unemployed and they don't have income and they fall in that guideline that you mentioned earlier, where they signed, an affidavit or something saying they're not working, is there any type of penalty for them not enrolling by, I think you all said October the 1st?
The Affordable Care Act does have, the plan is based upon as many people as possible getting coverage and getting in. There is a type of penalty. I really don't know the details of the penalty. I'm more advised on the Medicaid side versus the insurance side. But I'd really encourage you, there's several websites that have information about the Affordable Care Act that could probably answer that question. And also, if anybody has any question about their eligibility for CountyCare, I encourage you to call 312-864-8200. Once again, 312-864-8200. We have phone operators who are also application assisters, and they can walk you through. We have 6 basic screening questions. If you pass those 6 questions, you move on to the next level of review, and they could help determine whether you are indeed a CountyCare eligible person. So please utilize that number, 312-864-8200.
Hopefully, if you call that you find that you're eligible, you can also sign up. So
Absolutely.
2 for 1.
Absolutely. 60% of our members started off with a phone call.
Yeah.
Now, applications are taken at our 3 campuses, Stroger campus, Oak Forest campus, and the south suburbs, at the Providence Hospital campus. as well as we have trained over 500 application assisters across Cook County at all of our federally qualified health center sites. So, and that includes, just to name a few, PCC Wellness, the Access Centers, there are over 40 in the Chicago area, Erie Family Health Center, near North Health Center, I'm blocking, and Martha's, Heartland, even for our homeless residents of Cook County. Heartland Health Outreach actually goes into homeless shelters and takes applications there and actually provides care to homeless people in the shelters. So we've tried very hard to disperse our application assisters at many different venues throughout Cook County to make sure that as many people as possible know about the benefit and can get an application in.
All right. Sydney, you're very popular today, so we have yet another caller. So,
Wow.
caller, you are on.
Good
Caller?
evening.
Hi.
Good evening.
Yes, can you tell me how do I go about applying for CountyCare?
Sure, ma'am. You can call 312-864-8200, and the application assisters on the phone will be glad to take your application. If you live near a federally qualified health center, you can certainly walk in, and they'd be glad to take your application there. We are at many community events and taking applications there. And if not applications, we're taking names so we can call you back to get your information. But the phone has been a very popular and very effective way to take an application. As I say, 60%.
Can I have that number again?
312-864-8200.
All right. I think we
Thank you.
Oh,
Sure.
Thank you for calling. All right, we have another caller. Caller, you're on.
Yes, good evening.
Hi.
How does the program you're mentioning, CountyCare, differ from Obamacare? Because under Obamacare or Affordable Care Act, or however you want to refer to it, they have established penalties. The first year, they're going to keep it nominal, $95. But then the second year, it's all the way up to, I believe, $675, and it's progressively getting higher because the object, as the president says, is to basically get everybody to purchase insurance based on their income. So everybody has to pay something. So, again, I didn't catch the entire first call, but how does your program differ from that? I mean, I take it the goal in this is, for people to seek health care, and there's always going to be costs involved in health care.
Yes.
And everybody typically can afford something at some point in their life. I mean, you just cannot glide through your life not paying anything for health care. If you can, send me to that country. But how does your program differ from Affordable Care? Thank you. I'll get off.
Thank you for calling.
Well, our program is actually part of the Affordable Care Act. The Affordable Care Act has two components. One is the expansion of Medicaid for the medically needy and financially needy population, for folks who make under 138% of the poverty level. So that's around $17,000 a year. Our program, because we're a demonstration project, we start with an even lower threshold. So to be eligible for CountyCare, you have to make less than $15,000 a year, or $20,000 for a couple. So it is part of the Affordable Care Act. Now, the other part, the marketplace, the insurance exchanges, that's also part of the Affordable Care Act, but that's not what CountyCare is. CountyCare is the expansion of Medicaid, which is a state-run program for folks who cannot afford to purchase insurance.
I think people need to understand that the Affordable Care Act is a huge component.
2,000 pages.
Yes. So there's the marketplace is one component, and the expansion of Medicaid is a different component. So there's tons of other components that make up the Affordable Care Act. So.
Yes. Yes.
Do we have another call? Oh, I think we have time to ask some of my questions now.
Okay.
So again, we are the Breast Cancer Task Force. Okay. So our mission is to make sure women are getting those screenings for breast cancer. Mm-hmm. So is that covered under the CountyCare?
Yes.
And if so, where can they get one of those mammograms?
Well, we have contracted with Mercy Hospital. That's certainly a site where a woman can get a mammogram. University of Chicago offers mammograms. several of our hospital partners offer mammograms. So we really wanted to make sure that screening mammograms and any preventive service, that we had the resources to cover all those services. So yes, mammograms are available. We have many women who maybe last year had no coverage and they got it through the state program for uninsured women. They are becoming CountyCare members and they're getting it through our resources at this time now.
Great. So is there any fees associated with women receiving that membership?
There are no fees.
Oh, excellent.
There are no fees to CountyCare members. In fact, our prescription coverage, there is no copay for prescriptions. There's no copay for visits. We are not limited to the Medicaid, traditional Medicaid for prescription limit. We've really tried to make the CountyCare attractive and make sure that people want to enroll. We assist our members with transportation. We don't want transportation being a barrier to get care.
That's a great benefit.
So we provide CTA bus passes that are also good on the RTA. And for those who are either medically or geographically challenged, and by that I mean we actually had a member who had to walk. He lived in the suburbs. He'd have to walk 2 miles to get to an RTA bus stop. So we have a Medicar service.
Oh, great.
Where we can actually pick you up. Now, I know fiscally conservative folks may be saying, well, why are you spending all this money? But if we can get people to care, that will keep them healthy and prevent a very expensive emergency room visit or a hospital visit. So that's why we don't mind spending the money up front on transportation to make sure people can keep their appointments.
Okay. All right. So we are kind of running down time.
Well, we got some good calls.
We got some excellent calls, and I thank you all for calling in today.
Yeah.
But another question is, once you enroll, do you have to re-enroll every year? Is it?
Well, part of we are slowly melding into January 1st and heading toward January 1st when there's a full expansion of Medicaid across the entire state. Our current members will not have to do anything for January 1st. There will be a regular redetermination just like any other Medicaid program on a yearly basis. But in terms of what happens January 1st, our members keep their benefits, our network stays in place, nothing changes.
Okay. So once they enroll, do they have to pick a primary care doctor? Do they have to pick a site that they're going to go to?
We ask at the time of application.
Okay.
Well, first of all, do you currently have a primary care provider?
Yeah.
You may have one that's already in our network. If you don't have one, we ask you to pick one.
Okay.
And we provide you with resources close to where you live. If you have any particular health needs, if you have HIV, we have providers who are experienced in providing HIV care. As I mentioned, homeless. If you're homeless and you want a provider that's experienced working with the homeless, we have providers for that. Language certainly is an issue. If you speak Spanish or Chinese or any of the Middle Eastern languages, we have providers who provide care in those languages or Polish. So, yes, you will be asked at the point of application, where would you like to receive your primary care?
Okay, great. And so is it, once you pick that person, can you change, or is it you stuck with
a member can change every 30 days.
Oh, okay.
And we know things change. Somebody may move from the south side to the west side or from the west side to the south suburbs. So there may be many reasons to change a provider. So yes, a member can change every 30 days.
Okay. And then if there are changes too, like your address or your marital status?
We ask that you inform us.
Would that affect your eligibility?
Well, if it's let's say we have a woman who's in CountyCare, but she becomes pregnant. She'd be eligible for traditional Medicaid. So we would facilitate her getting enrolled in traditional Medicaid.
So would she have to sign up again for Medicaid, or is it just she's kind of?
Well, we're hoping to have a progression of services. I'm blocking the word I'm thinking of, but that there's a smooth transition. From one to the other. If somebody is on CountyCare now and they become disabled, we would help you, identify the resources for applying for disability. You may become employed. You may actually get a job that may have coverage. That's a wonderful thing. Some of our young people who are, college grads who are not employed now, but they become employed and they have CountyCare now, and next thing they have a job, we want to help them move on to their insurance from their company.
All right. So is there any last comments or last things you want to share with our audience? We have a great audience today. So any last comments, go ahead and share.
Well, I first of all, I appreciate the interest. I think that's the number one thing. Healthcare is vital Healthcare is something that we all need, and we really encourage, if you meet the guidelines or know somebody who meets the guidelines, to please call 312-864-8200. Please be on the lookout for our billboards. We have billboards across the city and the county. We have brochures. If your church or your organization is having an event and would like a county care representative to come out and be there, we'd be more than glad to do that. Once again, 312-864-8200. That phone number opens up all kinds of doors.
All right. Thank you, Mr. Thomas, for coming today. I'd like to thank you all for watching, and please tune in next month to CanTV 21 or online at www.cantv.org live on Tuesdays at 5 p.m. I am Tarnika Manning with the Metropolitan Chicago Breast Cancer Task Force. Thank you.